Hello, 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 and you're very welcome to today's program. Let me test you a bit. There was a king in the Bible, and he was running away from another king who was seeking after his life. He ran into an enemy territory, and when his enemies realized that he was hiding there, he had to do something so that they don't take him away. And Bible says that he pretended as if he was mad. He started behaving very strangely, and saliva was drooling all over him. Do you know your Bible, and do you know who I'm talking about? If we put this man's behavior to a clinician, there is something that clinicians will have to say. There's something that doctors will have to say about the way he behaved. And today, we are going to look at just that. Welcome to the Health Arena, where we bring you a lot of education so that your life will be better. My name is Helen Tettey, and I'll be your host. We'll take a quick break, and when we come back, I'll tell you all about our topic for today. Stay with and it's the Health Arena here on Tac TV. Before we took our initial break, I described a scenario. Did you get it? Did you know who it was? Well, I'm sure by the time we end today's program, you will be able to describe this person's action. Today, we are talking about mental health. As a Christian, there are things about mental health that we need to know. I don't know how well you know issues about mental health, but today, I'm trusting God that by the time we finish today's program, you will be well versed in certain things about mental health. I'm particularly excited to introduce our guest for today. He is an apostolic, he's an elder in the apostolic church, and he's actually the leader of the men's movement in his assembly. Dr. Jonathan Odame is a clinical psychologist. He's been doing this for over 13 years. He's happily married, and he's very passionate about people living a sound life with good mental health. Dr. Odame, you're very welcome.
Thank you very much.
It is a delight to have you here on Tac TV and on the Health Arena. You know, when you mention mental health, people get a certain kind of reaction, and I don't know why that happens. When you mention things about your heart, you don't get that reaction. When you mention things about your leg, your kidney, your liver, but immediately you start talking about things about the brain and talk about mental health, you get this reaction from people. I don't know if you can identify with that.
Yes, you are right. Even myself, as a clinical psychologist, anytime I'm in the midst of people will tell me that, hey, please, don't read my mind. So there's some kind of stigmatization, and there's some kind of perception people have about mental health that is really affecting the way they behave towards people and even the way they react in the environment and in the society. So there's that kind of perception or idea that when it comes to mental health, it's more of, in quotes, madness. But it goes beyond that. Because as a psychologist, I hardly even see people who say they are even mad. I see people who are normal, just like any other person. But that perception and that stigmatization is what is trying to envelope people's ideas about all mental health is all about.
Well, I'm trusting that today we'll be able to do justice to that, so that at least those who listen to us would have a different perspective about these issues. Odofo ye ma kwa abakese e de ba ene Health Arena ejumadie yi so. Na se ye kase obi akuma yare aba na akuma ho a. E na ye hu ni se we die etasi. Enhayen. Se ye kase obi ne nan muni pedua bebia. E na ye gitumi ntemtem. Na se ye kase obi na dwen kakra wenya ohaw bi wona dwuma ya na eye yen ya dwenye na ye hu nipa no krapa na I say we di I saw ya bodam now so ene health arena dwumedi ye tu esi ho say ye be pensem sa niam ne me nyine mu na amayetumi ate ase yetumi ehunia ekoso nia edeba na yetumi abo asankrofo no na ene otitiri ni oni yen edi sa dwumei ye mana kwa ba kese ye doctor kese Dr. Jonathan Odame doc enti ene ye de befrafra ye de brofo no eni twi no e befrafra enti yemfen fi ase no say ye ka say mental health den
okay me that say ye ka say mental health is adwemu apomuden ye de ba ye twi ka say mo a the account mental health is a state of emotional, social, and psychological well-being. As a person, what dream bibia okay, uhunamu ubibia okay. But oshe brofulina mental health. And you look more of the way I dream ye. Are you able to reason well? Are you able to decide? What be concentrate? Ubi eka sema na wasa uti besre. So wasa usua uti bisu. Intimi nyinano is what we look at it as mental health. That means that what do you know who apomodin say na oka bibi about say obi akomaya de ya obeko hospital obi na ya ya obeko hospital but say adwuma emfa na obeko. In fact I made the passing and the yes our program yi so that your viewers about mental health as say so that obi training mental health problem na ubenya the right people or the right cortesa or the no ebeko.
Mental health, we are talking of a state of well-being.
Well-being.
And you mentioned something. So, if I understand you, there are certain responses that we are expecting when we trigger certain reactions. So you're saying that the person should be able to laugh at the time they expected to laugh.
Yes.
The person should be able to cry at the time they expected to cry. So are we saying that these things, these responses are normal responses that we are expecting?
Yes. So when you do otherwise, that's where we look at abnormality. So for instance, if you are insure toy, now get an umbrella and I'm quite so. If you have also boy, and I say there only any skin problem, be a doctor say use an umbrella. Now you use an umbrella in the wrong way. At that point in time, you know, you better say you are doing something which is out of the normal. Now I call it abnormal. If you are catch or say be ewu, and I say be atu will be. For you to express emotions, you know, now you have something different. In Tabasana, you see no, there's something going on somewhere. And that is the problem. Also, can say too much of everything may be bad. And to be brought to the extremes, then people begins to raise questions that why are you behaving like that? Then it means that BB may be going on wrongly in your mind, mentally, the way you're ordering. That is how it is.
All right. So we understand from what you have said, we understand what mental health is.
Okay.
So when would we say that we have a mental health disorder?
Okay. You see, mental health is a very broad area. And we have so many sections under mental health. And as I started from a particular premise, you know, if we all know that this is the right thing to do, and you are doing it in a different way, so it means that you are going outside the order, then it becomes a disorder. It's like I had a patient who was overeating. At least as a human being, at least we eat 3 times a day. But if you are overeating and it's creating a problem, people are saying that the way I already did there, it is creating a problem. Then it means that you're having an eating disorder.
Okay.
If you are in a program, pay a lot of attention, which is okay. But say too much attention, even the way you dress, or dressing with a lot of bright colors. We all know that this is the order things should go, but the Oyano is off the lane. So you are looking at a disorder. So that is where we look at a mental disorder. Because we say, you see, it is normal to be sad and to be happy. But if you are overly excited and every day you're overly excited, you will be like, what is happening to you? Though being happy is good, at that point in time, in the society, there's a limit to everything. It's their own, the order that we know. So it's becoming a disorder.
All right.
And that is how it is.
And if we say that this is a disorder, is it something that doesn't happen often, or it's something that it is with us in our world today? How common are these disorders?
Okay, so these disorders are very, very common. But you see, before you can see that this is a disorder, it may take time. Let me even use this example, for instance. There was this guy who came to me as a psychologist, not almost saying he has a problem. And I'm like, what is he doing? In fact, he was always preaching on the road. And the way he was preaching, he was always talking and talking and talking, to the extent that say, or kasapuna se uchema, no pese uchinaho na utie the orkano. The people are like, no, adia we yadiaso, anything yakupon them. I don't need to stand there to listen. Until only being a confrontation, who say no, adia a yafa guy in the dream. I'm not a psychologist. As a gentleman, though I all preach, the content of the message is correct, but the way all corner is going beyond the order that we know. And of course, most of the time, when it comes to religion and mental health, so Obi is so religious, now he has a mental problem. As a psychologist, you're not in him, because Obeka so give your life to Christ, give your life to Christ. Not all shouting or marching or bombay usu or yes, but also no, the way are all is going beyond the order that we have. Yes, for instance, there was a case, woman he was brought to me by the husband, or say, witches in his family, in her family wants to kill their child. In Titim, you're sorry, not the salt, epitipity, if you honum, nor the oil, epitipity down. He was suspicious about people, and they will say, no, this case, though it's good to be suspicious, we are going to the extremes. Okay. And I need to know at the bar for therapy, because we will see, no, this is a disorder. Okay. Because of course, if you pray to God, God is capable of solving the problems. If you sprinkle salt, it's enough. But sprinkling salt, mentioning people's names, using the Bible, using this, using that, we will say no. Let me see a psychologist. Even if it is okay, let me see a psychologist for an assessment. And truly, when I assessed the woman, I realized that he had a little mental illness and he was put on medication.
So you're saying that we as lay people or ordinary people, we don't have what it takes to be able to tell that this person has a mental disorder. The person will have to be brought to the psychologist.
Okay, most of the time we all have the ability to know, because before anybody will bring you, at least the person will see that what you are doing is affecting you yourself, is affecting the environment, people around you, and even the work that you are doing. So most of the time, people who will bring you would see some signs that Adia is to the extremes. Okay. Yes, for instance, when I started my work as a psychologist, there was this woman, my husband, the wife, no our problem. But some are not dating, they need ankoso because of love. They always say that love is blind. But when you marry, then your eyes will open. The woman was extremely neat. Anytime Okosrana, the woman was very, very neat. She uses white bed sheets. BBI white. Then I'm so lucky I've got married to a very, very clean woman. The woman would wake up at dawn. After they've had an affair, we'll let the man stand up. He will go and wash the bed sheets, because we'll say the sex has contaminated the bed. Okay. When the man uses the washroom and the woman goes there, flash, no problem. I'm not going to is here 20 minutes. Hey, the visitors leave her. Then the woman will go and sweep the room. He will sweep and sweep and sweep. The woman will wash her hands and wash her hands. When now, as normal until one day. Woman,
you couldn't as normal.
Oh, so you see the wife there extremely neat. Wow. As normal into a baby girl. And now, the class with the body grow of form. So the child was crawling. Anytime the child is crawling, the wife will come and pick the child. No, could be no. A day, we got a no 10 times. I don't see no. The way I air it's becoming a problem. And not in the hospital. And see, the question that you asked, we can all see because we know what is orderliness and what is a disorder. And see, the way the wife behave, is to the extremes. I'm sorry. Another also case also that I also was brought to me since they care about mental health, there was this woman also and I just sorry, I check if we're locking in Diana. She will tell the husband to lock the door and she will go back again and go and check.
So no, I security conscious.
But it's to the extent, even to the extent that only Kuruma sorry them. They have put off the iron before they left to the church. Now, what's the message? Darling, did you put off the iron before we left? I said, oh yes, I put the iron off. I said, are you sure? To the extent that one day they went to church, the woman went back home to check if the things were put off and came back. No, the husband was like, no, the way my wife is behaving is becoming a problem. And she was brought for a psychological assessment.
Wow. So if I'm hearing you right, the people that we live with, these things can happen. But it will take us to be vigilant and us to be able to tell that this person is now going overboard. For us to now bring the person to the right place to get help.
Yes. I like the word you use, vigilant. If I'm not vigilant, you wouldn't see. Because there was this lady who was brought to me with suicidal thoughts that she wants to kill herself. She had attempted 3 times suicide. Not knowing she had a problem, we call it she was always pulling her hair.
Okay.
So I was like, Mommy, your child has another problem. I'm talking to her, but she kept on always pulling her hair. And she has not even seen it. So I told her that from today, I don't want you to have that perception that she always pulls her hair, but you be normal. Anytime you see her pulling her hair, you just record it. And before she left the therapy room, the lady had pulled her hair almost about 20 times.
Wow.
Yeah, so I like the word. If you're not vigilant, you wouldn't see. You wouldn't see at all.
Wow. Well, viewers, we are discussing issues concerning mental health. We'll take a quick break. And when we come back, we would continue with this. So much for staying with us. This is the Health Arena and we are discussing mental health issues. And with me in the studio during this discussion is Dr. Jonathan Odame. Doc, even before we go back, we've been using a big word. We introduced you as a clinical psychologist. Now, that word kakrakawe.
Okay, that's it. So, a clinical psychologist. Okay, so mami explain na yinayenti ase. Ejuma doctor eyeno, enwebi and amiye. But me there's a difference.
Okay.
Me wopanye, me sound so a madrip. I use psychology to work on people, to help people to recover from their problems through the help of God. Sometimes okay. In the hospital, doctors say, okay, fine. And then no matter all the symptoms, also coronate lab test. Okay, malaria, okay, typhoid. They say you go out of COVID anyhow. Until you don't COVID. Okay, all these tests are negative. Also still me yare. Okay, get these multivitamins and vitamins. Na kono mufie. Or the amount, or the coffee. Also after 1 week, bra for review. Oba yes still. Oh foul. Also doctor, me ya. Okay. Yeah, all the tests be negative. Sadia konekohu psychologist.
Okay.
And at that point in time, so I'll look at the doctor natural, because I have to follow what the doctor has said. And so far as it means that the issue now becomes mentally related, because the mind can cause illnesses. The things we think about can affect us. When I was a student during my master's, there was a question me the Maya. Almost say words can kill, words can heal.
Certainly.
Yeah. Obu anuma obi akase ni akire no. Na asem no tete no. Into man malaria symptoms. And I'm on the typhoid symptoms, but typhoid na no. Because you see, I like your show because I believe in future we will look at issues of even convention disorder and hypochondriasis. Obu anuma diba pain so yare. Obu anuma will have severe pains on the knee. But we or the dress raso abona ki echo bam wala body all the bam asraso. But enkoye, they took a doctor, yes, a brand new psychologist. And he said, Oba, I'll take you through assessment to know what the problem is. Okay. And you know, I will not use medications. Okay, so me show a condition, now you're so severe, then I'll recommend you to see a doctor who will assess you medically, and the doctor may give you medications. Okay. Yeah, so I normally use more of counseling, talk therapy, and psychotherapy to help people. So when I went to school, I studied how I can use psychology with the help of God to help people come out of their problems.
I like the fact that you say with the help of God.
Yes.
Because the body was created by God. And so for us to be able to understand and deal with issues of the body, certainly God's help make a difference. So if I'm understanding you, you're saying that what you do so that from here on, we know that if we say we are going to a clinical psychologist, you know exactly what we are talking about. So there are diseases that, even though you might feel symptoms in your body, they are not coming from your body. Yes. They are not coming from maybe germs that we know cause diseases.
Yes.
But there could be issues happening within your brain, your thought process, your thinking. Yes. And that can lead to those symptoms.
Yes.
And so when we have those issues, the specialist that deals with them for us is the clinical psychologist.
Yeah, it's the psychologist. Let me give you a scenario. About a month ago, there was this lady, she's about 28 years old. The grandmother died of breast cancer. And the mother also died of cancer. And she's now saying that she feels a lump in the breast. In fact, she went to the hospital, she did all the tests, almost say only cancer. Even that thing is, she even thinks it's a lump. It's not even a lump. There's nothing cancerous in her breast. Do you know that the lady was having all the symptoms that somebody who has breast cancer would have? Because she thought that because the mother had that problem around her age and the grandmother, she was having all those symptoms. So as a psychologist, I had to take her to psychotherapy to restructure the cognitive that no, the fact that even somebody has these symptoms doesn't mean that you have such symptoms. So in this case, the mind was creating those illnesses and those perceptions. It's like a gentleman that I also met who had slept with a lady who had HIV. The man was dying. The man was dying. And what happened was that the man wanted to marry the woman. So they went to the hospital. Then they did tests. All the tests. And it was like, oh, the lady has HIV. But fortunately, the guy was negative. For him to accept that
he's negative and he doesn't have
it
HIV.
Was a problem. He had to come for therapy for almost about 6 months. That though you had it, by the grace of God, you didn't get the virus. And he was having all the symptoms. He had fever, rashes was on him and everything.
Wow.
Yeah.
So these things that you have described, so you are giving us different scenarios and situations where it will be easy for us to now identify that there's something not okay. We need to seek help, and we know that if we need to seek help, we need to do that from a psychologist. Okay. Broadly, what would you say are the symptoms that people would usually show? Because I know that from what we have described, mental health is quite broad. But what are the symptoms that if we see, it's a wake-up call for us to look again and see what is happening? Okay. What are the things that we can see in people or see in ourselves and be able to identify?
Okay, so some of the things that you can see, I'll talk about certain few things so that it will be very, very common. You see, when you are there and you are not able to sleep very well. We call it insomnia. Or when you are overly sleeping, that is hypersomnia. It means that there is a problem.
Irrespective of your age?
Irrespective of your age. But you see, as we grow old, our sleep patterns reduces. But when it's such that you can't sleep very well at all. You know, some people, they sleep, okay, so let me say that a normal human being should sleep like 8 hours. But now, because of our economy, like 6 hours is okay. But if only you can't sleep. And you see, why you can't sleep, sometimes it's because of your mind may be awake. You may be thinking. So if you are there, realize that, or you have also lost interest in food. You've lost appetite. Also a common deal. And a common deal. But we want to at all. It's an indication that something.
I'm sure we'll be back.
No, because you see, as a normal human being, on a normal day, you should eat. But if you are not fasting or do anything, now common day, it's a problem because the body needs the food, the nutrients, and the energy to help you. And you see, after society it tends to affect your body a little. So you can't sleep. So how will you know the person is telling you that and you're fine? There was a patient also that when you do not so let me see there's no medication that yeah, and you see, as a psychologist, people bring all these issues. There was this woman, for instance, she says that she thinks when she sleeps she will die because authorities say yes or die. I'm sorry. And you know, daytime she will sleep, at night she will be awake. She will not sleep at night. Such a person or approach you this condition, I would say at least something. Yeah. Okay. So sleeping would give you an indication. Okay. And the food, is lost appetite, and also concentration. Concentrating on whatever I'm doing. I make a lot of mistakes. It tells you that there's something going on somewhere. And I have to say, I always forget about things. It means that his mind, not will be so, and at the same time, it's on something else.
But when we get to menopause, we start forgetting our things.
That one is different. Because there are some people who are always spectacles like the way I'm going, but not much to share. Yeah, so all these things tells us. So you can't sleep well, you've lost appetite, you're even losing weight. Yeah, or you're even gaining weight. There was a woman like that who was going through a lot of emotional issues, and she was gaining weight. And I asked myself why. She told me that she eats as a form of compensation. To comport herself. So you can't sleep well, or you are sleeping too much. You can't eat, or you are eating too much, or you even feel like killing yourself. So if you are there, if you are watching us and you've ever had that thought of committing suicide, please, you have to run and see a professional for assessment. Because the moment those thoughts come into your mind, you might see life as not worth living. You don't have joy in life. You are always sad. You feel guilty about life. You think you are a failure. You think you are useless. You think people hate you. People don't like you. You think God is punishing you. Until when an obi catch there was someone who say no, the person needs a mental health specialist for attention.
So can you, this for me is quite important, and even though we've said these things in English, I would really want us to break it down so that everybody understands.
Okay. Yeah, me that say. Now in the program, no, yeah, about Adwuma Pomodin. And now all beside say, how would somebody know say or Adwuma problem? And I make her say, so honum, na say untimi end the year. Unse di piano at least also that between 6 to 8 hours. So any medical condition like diabetes, hypertension, and any chronic illness and as a doctor and diagnose you of chronic stress, then it means that there's a problem. After so no one say untimi NDD thing they are no at all. And you say udidi kakra but untimi di cry or say there's a problem. And obo also untimi concentrate. We meeting as if discussing baby now I that baby. It is a problem.
Aba sorry.
Aba
sorry. You on kashi.
Oh yeah, on kashi. Woman bia, in fact, man be catch me say, my friend the wife, now the wife for problem. And actually I went to the church there because I'm seeing them there, I saw them one. The wife is always sleeping, even during praises. Yeah, to na order. But or say or kind is on that. But yeah, sorry, dear. And I want to see your wife. And he made me come to the church there.
Yeah.
And I observed it. The woman was always sleeping. And in this case, what we say, there's something going on. And so we think they are way free near or the idea to her, not way free, need mean that, need to be NDD, who is the appetite, who say, and then dear, like catch here, and say something serious. Say, your thought of killing yourself, please tell someone or see a health professional. Because the moment as I thought in the bano, you see yourself as useless. Why am I living? If I say me tea, then I'm AJ. And the devil may even come in, say then kill yourself. What means when you pump air punish show? What means you'll be a tile? Into way you know, so be a on with this I didn't come out, me patrol. Who show ye, Manuku doctor, may I say no.
But you know, sometimes I've encountered a few people like that, but they give you reasons why they are behaving or showing these symptoms. For instance, I've seen somebody who would say that Mishro say we obekumi into Adriane no ya needy. And the way they are presenting it, it sounds reasonable. I won't go to this place because I think that when I go, they'll kill me. Is it different from what you are describing? Okay,
you see, we have the spiritual aspect, the religious aspect, and the mental aspect. You see, okay, so though I am an elder, I don't have those spiritual eyes, so I can't really prove that this person in quotes is a witch or this person is a wizard. But you see, the moment you have those thoughts, it can affect you. Because OGNC, we per se okun, we per se oyewa. Supposing they are living in the same house with the person, maybe it's your mother-in-law or your father-in-law, or even your husband or your wife, it will affect your relationship. And you might behave in an abnormal way, which will create problems. Yeah, because I know what you are saying. People have all those ideas.
Yeah.
Yes, yeah. Mommy do it, mommy do it, mommy do it, mommy do it.
Yeah, me say.
They'll catch you,
wow.
You have to let him give you solutions on that, and then it will affect you, because the more you think about those things, it can even let you withdraw yourself from people, and you're all social beings.
Right.
Yeah.
Well, viewers, this is getting more and more interesting. We are looking at mental health. We've looked at the symptoms. There is more in store. Please stay with us. We'll take a This is the health arena, and we are discussing issues concerning our mental health. Just before we went on the break, Doc, you shared a story with me, and as you shared it, I remembered another story. In fact, one day I was in the consulting room when a woman came, and she said, "Yare we are a yemi doctor. Me die chisa, it was a nedie, upe drumami." Then she started describing Eyana Michi, and the way she was moving around everywhere. I just listened to her and I asked, "Are you married?" Then she said, "Yes." So I just zoomed in. I said, "When was the last time you had sex with your husband?" "Oh, Sadieno. Sadieno me jaye da. Then I asked, "What jaye saying?" Or say, "Oh, me kunu makache and say, Sadie we die, me to me any NW. Enti, me ankasa me tuni for say, uncle pe obabi, na oprobi ne nada, no nyo oba nada. But if you are jenny yakani na, me me amano." And I was like, "Are you serious?" I said, "Oh, that's the way they mean bonny. Me aminim say adie we mean to me nye. and a mama mikunu solution. Enti enwa. Then I said, Mommy, we are. I said, Mommy, Baba. Mincho drew be a mouth.
Yeah.
Ko na eni ukunu enkoda. We are Signbra. You know, I didn't see this woman for over a month. The next time she came with her husband. So, with what you are describing, this woman should have gone to see a psychologist.
Yeah.
With this kind of behavior, that you can decide that my husband, go and look for another woman and sleep with her, but don't marry her. I'm still the married woman. Wait, age more.
So interesting.
Anyway, so we've looked at some of the ways that issues of mental health can present. Yes. And we've looked at if you see something that is a bit out of the ordinary, where we should go to, we should see a clinical psychologist. After you have taken the person to the clinical psychologist, what should be our attitude towards the people that we have taken?
Okay, thank you very much. So this even brings about the issue of stigma and stigmatization. You see, before the person would even come to the psychologist, you see, the person might have gone to other places. You see, people even do self-medication at home. But they may tell their friends who may even recommend other drugs for them. Now, some people would now resort to spiritual help. If you are going then they will come to see the psychologist.
The moment your last stop.
In fact, last stop. So most of the time, I ask my patients, people I see, and some are all bahano, and I'll call it, and then you catch you, so that I'll not repeat the same thing to you, because I want differences, not similarities. So the person who is bringing the person, I'll interview the person. Then am I so far? Okay, say. Because you see, most of the time, I would say that Africans, I will not even say Ghanaians, but Africans, we are very, very spiritual and religious. And to be we attribute it to the spiritual world. That if you are the fee, we going to feel and so I'll ask you all these things that you have. Okay, fine. So being an area now, me, I'm a psychologist. I can't prove spiritual things. I will use psychology to what? To help you. So you, the person that you brought the person, then I will also educate you on the condition that now the person has a problem, and the person might be given medication from the doctor's recommendation, and you have to show the person love. Because the fact that the psychologist, I make us say, or I give you problem, and she say, start observing whatever he's doing to even reinforce the behavior. And I want to say that, you see, Obi have a mental problem. He's put on medication. Okay. You see, malaria, most of the time, you might take Coartem or Lonat for 3 days. Doctor. But psychological drugs, it can take time. Until you go for the best 3 months. Everyone be for review. So whilst the person is on the medication, he might not fully recover as you think he should be. Even if I recover crampona or actions, leaving the person, can let the person again relapse and come back again. So those who bring them, I always educate them against the stigmatization and to show excessive love to the person and to monitor the person's behavior. There was this woman on the wife. This woman on the man brought the wife. And papa ni ko fie. O ka chu fie fo nyina na say or the wife a psychologist. There and then people were thinking the wife has a mental problem. So we jamu na mabodam na psychologist. You see, so we need to show love and show care and take away all those stigmatization. As I said earlier, all my life as a psychologist, I don't even remember seeing people who are extremely bad. I see normal people. People think that those who come to see us, are people who have mental problems. And even if you have normal headache, you can see a psychologist. Because you see, there has been a change in your behavior because of the headache. People got admission for like 1 month. So at the hospital, before you are discharged, and make sure you see me before you go home. Okay. Because you see, you've left your comfort zone. You've been in the hospital. Now you are going back home. How will you integrate yourself back home? When you on leave, how will you eat? How will you take your medication? Who will give you the support? So before you leave, I make sure that you can go back to your situation. So those who bring people to us, please, we beg them. We are just like any other physician or just like any other health care provider. The ideas that we have about psychologists, about mental health workers, that we see people who have mental problems, goes beyond that. We should show people who have issues love. And I don't know why I'm saying that. People always say that, oh, even when I go to a program, oh, he's a psychologist. Hey, share the day. And I'm saying, hey, how will I know what it is? People normally tell me.
I see.
Tell me what I'm thinking about.
Okay.
I know you can read my mind. I'm like, no. I have to assess you.
Before you can tell.
And even the assessment, the person already have a preconceived idea, thinking that, so I would tell those who seek for help, those who bring people to see psychologists, that they should show them love, and they should take away the stigmatization that we have about people with mental problems.
It is a only obiko hospital near you, nipa way or wakumayari. Obe nipa ne do, obe supporting nipa ne se nebeya. Inu na ye dia man se omfa no. Obe boa se obehwe so afa. A wo yes na wo expect se obenya improvement no. Saa na se ye kasa ye di obi clinical psychologist ho, obi wo mental health issues a. Eni ye ya ye wo nipa ne ho no. Yanso ensese ye tu ni din.
Yes.
Ensese ye tu ni din o enum de sa ade ne ba ade na bo
kakra wo ho.
Odofo utie eto de bia ye ta yesa pa. Ebi ade we hu se nipa na ye bibi nipa mu ebi oba sorry muko baby and I who said, oh, ye bibi kakra, what shall ye uncle ye? What say I say, ye did not call doctor or her adreno say, or reno, any or coba, saffron. Nia and the ye sian say, sound crofone was say ye chair or mo or do, sound crofone was say ye bois or mo, send a bear near almost femuno, omo to me, efim, and omo to me after a drawer and a quanchaya diamo to me, yen, kama. Emma omonso omunya ahoto na enyo bia okohu clinical psychologist ena bibi hanadwen omoya counseling
guidance and counseling, even career aspirations, obu onoma even your temperament, obu onoma even what course you should do at the university, obu even the occupation and onim, even family therapy, couples therapy. A lot of things comes to us as psychologists. Yeah, I remember we call program be say, and a lady be eba approach me. When the casa ye, who be me say, lady no, me show mental problem na. And I say, she came on a different issue, but because the person thinks that the lady has a mental problem. But even to know what the lady told, when I'm saying Debbie, she rather came to ask me how I was able to get to that level. If you see the stigmatization and everything, you go somewhere, people know this person has a problem. If you are wajo number, and that's no bon people are passing by, they are trying to read
meaning into it.
And that may not always be the case. That may not always be the case.
So these things that we are discussing, we are looking at adults. Does these things happen in children as well? Yes.
Children may also be having mental problems. Especially, see, there's a statement that charity begins at home. So if a fear environment, is not good enough, it's not very, very peaceful and friendly, we will say, Akolano, we need but not give me no, everybody now, because children even go through depression. Children go through stress. Yeah, and but he has gone through a lot of traumatic experiences through physical abuse, even sexual abuse and domestic violence. Interbasana affects akolana dream. Into Namukrampo na, he has a very low self-esteem. You see, me can say, words are powerful.
Yeah.
Words can kill, words can heal. So even as parents, what we tell our children, it can affect them. Oba Airco school will say, okay, so there was this case, there was this woman, I had parked my car, and now I was on my phone, and a woman, catch the ban and say, oh, you think you can kill me? You can't kill me. We mean say a fool. Then I called the woman. Obani a small girl. Why yeah dear? What's the name to say a fool? Then I told the woman that I'm not sure dear.
Wow.
Do you know how a fool looks like? And I'm call YouTube. And I'm Google Accra mortuary. And I'm say, Obani was a say a fool no. Open say or Kwanum. No say Debbie. The Kwanum said yes. I somehow Kano.
That's what you
that is it. And you say actually you have that idea. Mommy says I'm like this, I'm not nice, I'm not this. And we always say that we may get what we say. It's actually being but it might say kakai, because also didn't say it is safe. And this child, it will affect the child's self-esteem. And when you have mental problems, or school, who know as a bad person, who know as ugly, who know affecting. Into what we tell the children, the way we relate towards them. Obuopa or babe to another three, or compare with the wabon, with the women, my dear, with the like father, like son. All these things, it affects their children and it affects their mental health.
So the things that we say to them, the environment in which they grow, can affect their mental health.
Yeah, their mental health.
For children, how do they also show that they have issues with mental health?
Okay, yeah. You see, we have people who have different personalities. Who's a collaborator or you're introvert or you're very, very quiet. Or also you're extrovert. If it's all a collaboration, now you know the way the child behaves. Now all of a sudden, who differences be in the child? It tells you that the child may be going through something. So you, the parent, so what are you going through? So how will you see? Akolano don't say one or school not the and it tells you that maybe there's a problem in the school there. Or maybe a daddy or mommy, because school, no teacher said this. My friends were teasing me and I was crying. It tells you that there's something going on. And Akolebo also is socially withdrawn. And now for now could be a grown no and some children took me say, oh, did they so say thing we are not with or company of waist pains. Nina tells you that there's something going on. And most of the time, as parents, we have to engage the teachers and look at the child's reports. All of a sudden, a kind of performance, so it tells you that these are all symptoms. I will say you.
Okay. So mental health issues are real. They happen not only to adults, but to children. Our time is really running. But what about the elderly? I've heard stories where an elderly person, you fed the person, and nkofobani ebisana or see, oh, is that one also part of it?
Yeah, you see, when people grow, okay, so when people grow, they tend to regress towards an earlier stage of development, and you realize that they may behave like children, and they may behave like kids, and they want attention and they want care. Once Obuano Kampona, there are a lot of problems and conditions psychologically. In future, we look at it. Obuano, to get attention, that is seeking help, using illnesses.
All right.
And when you are not well, and I say, oh, for what? Who's extra care?
Attention.
Even as parents, special food, malt, coke.
Okay.
Because we want the child to be okay. So in this case, the person may be using that to get attention. Because we need that love and that care.
But and then you say oyari.
And also oyari, if you are not a refree, because some people may have dementia and delirium. All these things are issues we can look at. Yeah.
It looks like we can't exhaust issues on mental health. We'll take a quick break, and when we come back, we'll finalize our discussion for today. This is the health arena, and we have been looking at mental health issues. And discussing this with us is Dr. Jonathan Odami. Doc, so we've been looking at what it is, how we can tell, or what are the signs and symptoms that are common, and how we should deal with people who have mental health issues. But before we go, how can you as an individual have good mental health? Because we've been looking at the disorders, but how can we ensure that we have good mental health?
Okay, thank you very much. So it all starts from the mind, the kind of things we think about. So I would tell people and our viewers that we should have positive thoughts. We should remove all negative thoughts, because the more you think negatively, it may lead to other things.
Okay.
It may give you stress. It may cause anxiety. It may cause depression. It may even it may even cause suicidal thoughts. So first of all, think about good things.
Watch what you think.
What you think about.
Go along with scripture. Scripture says we should renew our mind.
Yeah, with the word of God.
Yep.
We should cast all our burdens onto the Lord, for he cares for us. So positive self-talk is very, very important. And as a solution, we should also make sure that we exercise a lot. As individuals, sometimes exercise a lot. I don't just say you go and join a marathon, but normal exercises. You can wake up in the morning, maybe take a stroll around your compound and the rest. And it is good. You see, there's this neurotransmitter. There's a hormone that the body releases. It's called endorphins. So the more you're exercising, it's even good to be dancing. There's one of my patients, I told him that he should join the dancing department at University of Ghana for their sessions. Because Okwa, he'll go and dance and he'll be happy. So in Tanpebia, he plays music in the house to refresh his mind. Na osa.
Your question was say yes, sir.
Yeah, osa. Na endorphins, release, you feel good. And also you should have very good physical health and also eat very well, because you need energy from the food and you need to eat very, very, very well
to be able to get your sound mental health,
and also sleep very, very, very well. So if you have a sleeping problem, please go to the doctor. Some people self-medicate. They go and buy sleeping tablets and the rest. Please, say doctor, and can't chill. And on phone too, so I'm a patcho. Now for us all to sleeping tablets, so because it can cause addiction, it can cause a problem. So you're weighing down, wow. You eat well, you sleep well, you have good social network, you have good friends. And if you're having any problem, please seek for help, professional help. Yes, people you think they can help you. Because the moment you keep things to yourself, one show you are not born some so all kinds of advice to create a problem.
Seek professional help, exercise, eat well, sleep well, and think positive thought. Let the word of God rule in your heart and in your mind. Doc, it's been an awesome time having you. But before you leave us, what will be your final words for us?
Oh, thank you very, very, very much. What I want to say is that there's always a hope and there's always a solution, and no condition is permanent.
Wow.
So whatever you are going through, have it in mind that with Christ in you, there's hope and there's glory.
Christ is our hope of glory. Christ in you, the hope of glory. Well, we've been talking to Dr. Jonathan Odami. He's a clinical psychologist and a member of the Apostolic Church. He's actually an elder in charge of men's movement in his assembly. I believe that you've learned something. Mental health issues are common. If we open our eyes, we would see the issues around us. But there is always a way out. Get professional help. And for those who are seeking professional help, family members, people around them, show them love and support them. Thank you so much, Doc, for coming.
Thank you.
And our viewers, thank you so much for staying with us. I want to say a big thank you to the women's movement. Today, I'm helping to celebrate 75 years of women's movement in the Apostolic Church. If you haven't got your cloth, go get one. I bet you like my dress. Thank you, Women's Movement, for my dress. I want to say a big thank you to Lady Kesua for my jewelry, and TSC Media. Thank you very much. If you have questions, if you have comments, our numbers are on the screen. Please do well to contact us. Until we come your way again with another episode of the Health Arena, stay blessed. My name is Helen Tettey.